My name is Mary Kurniawan. I'm a social worker here with Monument Health. There's been a great deal of uncertainties that are coming at us really fast over the past few days with the COVID-19. Humans are really hardwired with a desire to feel in control, and when all of these changes come at us so quickly, we start feeling out of control. And so there's some really common reactions that we can expect during times like this. There's emotional reactions. A lot of people feel fear. A lot of people feel frustrated, sometimes angry. It's not unusual to also feel some suspicion or mistrust towards others. And certainly anxiety is really high. So those are all normal reactions to times like this. There's also really common behavioral reactions. It's not unusual to feel more on edge and to even have emotional outbursts at times. It's not unusual to have more difficulties keeping up on work or more difficulties concentrating, focusing. Sometimes we might notice some physical reactions. It's important to realize that these are all normal again. If you're feeling far more tired than you usually do, even if you're getting the same amount of sleep, that's not unusual. Sometimes people will notice increased thirst or drier mouth. It's not unusual to notice increased sweating. Sometimes people will also notice headaches or other physical pain that they've not noticed before. All of these are common reactions, but there are some reactions that would indicate that a person might want to seek some help. It's normal to feel overwhelmed. However, if a person is feeling despair or hopelessness for long periods of time and it's not going away, that would be a time you'd want to reach out for help. Other times that you would want to reach out for help is if you're having any thoughts that it would be better off if you were not alive, or thoughts of ending your life. There are lots of resources out there. The National Suicide Prevention Lifeline is one. You can reach out to a loved one, and you can always call 911. As I said before, there's a lot of things that we might be currently feeling that are really uncomfortable and distressing. It's important to know that there are ways that we can lessen this distress, and it's also really important to remember that as humans, we're very resilient, and this will get better, and we will feel better. I'd like to share one tool that can be really helpful for managing uncertainties. This tool is called a circle of control. We do have some choice about where we put our time and energy, and so this tool can be helpful in figuring out what we want to focus on. In anybody's life, there are certain things that we have 100% control over, and there's other things that we have some influence over. And there's other things that are completely outside of our control. So looking specifically at this situation that we find ourselves in with COVID-19, when we look at the things that are completely within our control, we can think about what we might do with our free time, whether we exercise or not. Most of us have some control over whether we follow social distancing guidelines, at least outside of our job we do. And so these are things that we can really focus our time and energy on. Things that might be more in our influence but not entirely in our control is talking to friends and family about what we're doing and what we think others should be doing to manage the uncertainties right now. Things that are outside of our control are whether strangers follow social distancing guidelines or not. Who gets tested and when. These things are obviously things that we think about and that we worry about, but we don't have control over. So it can be very helpful to make sure that we're really focusing the majority of our time and energy on things that we do have control over. It makes us feel more in control in these times of uncertainty, and that does lessen the distress that we feel. I just want to acknowledge again that there is a great deal of uncertainty in our lives right now with COVID-19 interrupting almost all parts of our lives. If you want to share this video with others who might be struggling, please do so. and we're going to share resources that might be helpful for you. Be well.